Hello everyone, this is Sachan, Assistant Professor, College of Paramedical Sciences, Rama University, Mandana, Kanpur. So, today we will discuss about the topic is fitting of soft contact lenses. As you know, the contact lenses is the optical device which is used to correct refractive error and used for the therapeutic purpose, cosmetic purpose and many more. So, we should know how to fit and what are the requirement to fit the contact lenses. So, we will divide the contact lenses fitting procedure in 3 steps. One is pre-fitting examination, second paramedic selection and then last is post-fitting examination. So, as we discuss in this topic, first introduction, need, occupation, general health, in general health systemic disorders and mental health, ocular examination and rest on. So, first we discuss about what is fitting. Fitting of contact lenses is the most important part to dispense the contact lenses. As you know, first we fit contact lenses. So, as we fit the contact lenses, we require a pre-fitting examination. In pre-fitting examination, we should have the need of patient. So, patient why the patient need a contact lenses, like for refractive purpose, for therapeutic purpose and for cosmetic purpose. So, we should know the purpose of contact lenses, why it is required. So, next is occupation. What the occupation patient have, like is using for the party wear, for one day or for long hours, short time, short derivation, that we should know. Next is health. How does it affect? Because health is affect in a fitting of contact lenses and life of contact lenses. So, health is required. As first is systemic health and ocular health. In systemic health, patient have any disorder or not, and second is mental health. So, patient is stable mentally or not. If a patient is not stable mentally, so it will affect the care and maintenance of contact lenses. Next, what we will examine? We will examine the ocular examination. In ocular examination, that means patient required on a fitting to the eyes. So, we will assess first lid, conjunctiva, cornea and tear film. So, what we will do? We will do first in ocular examination lid, conjunctiva, tear film and cornea. So, we should know the lid examination, conjunctiva examination, tear film examination and corneal examination. In lid examination, patient's lids are healthy or any illness are present like stye, chalazion or follicles. Next, conjunctiva, is there any congestion or present or not? Conjunctiva is clear or not? Tear film, the minimal requirement of tear film is necessary to wear a contact lenses, because tear film play a major role in contact lens fitting and use of contact lenses. Next is cornea. Is there any opacity, any scar or any neovascularization are present or not? So, the 4 things we will observe in examine in a ocular examination. Next, we will do that is refraction. So, after ocular examination, we will do refraction. In refraction, we will cover like first spherical and cylindrical power. Is there, what is the power of spectacle? In spherical power, there are 2 types of power, spherical and cylindrical. Patient having only spherical or only cylindrical or spherical plus cylindrical combination, because based on that we will choose our contact lenses. Next, we will calculate vertex distance. Because in contact lenses and compared to spectacle, so spectacle or using on the in front of eyes and contact lenses on the eyes. So, there are power difference. If you are having a power in higher dioptric power like more than 4 diopter, so you have to calculate the vertex distance, because power will change in plus and minus both the cases. And if patient have any cylindrical power, so we require the spherical equivalent. Spherical equivalent will purposely use when the ratio of spherical and cylindrical is 4:1. Like spherical is 4 diopter and cylindrical is 1 diopter. So, we will use the spherical equivalent if the ratio of the spherical and cylindrical is 4:1. Then we will do the keratometer. So, next we will do the keratometry. Keratometry, you have to measure the curvature of the cornea in both the meridian, vertical and horizontal, and separately for right eye and left eye. So, is for use the assess the base curve. Why it is required? To assess the base curve, because base curve will choose in a contact lenses, that is used for the fitting of the lenses on the cornea. Next, we will complete the corneal diameter. So, in corneal diameter, we will measure SVID and VVID. What is SVID and VVID? SVID is horizontal visible iris diameter and VVID is vertical visible iris diameter. So, when we will measure, so we will use the PD ruler or street lamp, both we can use, and for the assessment SVID and VVID will measure with the scale, and then last we will complete the spherical equivalent for the power. So, this is complete for the pre-fitting examination. So, this all the things we cover in the pre-fitting examination, and next we come to the parameter selection. So, parameter selection will complete, 3 things are required. First, overall diameter, and second power, and third is base curve. So, from where we get the overall diameter? So, overall diameter we get from the HVID. Whatever we get in measurement scale, we add +2 mm in HVID. Clear? Then power, after calculation of spherical equivalent or spherical and cylindrical combination, we get the power for the contact lenses after correction of the vertex distance. And then base curve. For the base curve, whatever we get from the keratometric reading, we add 0.8 mm in the flattest value. So, we make flattest face curve in the flattest value, either in mean k, either in mean value we add 1 mm in a average value. So, this is the base curve calculation. After calculation of base curve and power and overall diameter, so we selected the contact lenses with the all the parameters. Then we are coming to the post fitting examination. After getting the parameter selection, we put the contact lenses on the eyes, and after the contact lenses on the eyes, we'll do the post fitting examination. In a post fitting examination, we'll do the things which are required to assess. There are things which are required to assess. On that, first thing, we'll do examination with the help of slit lamp. So, on slit lamp, we'll do first, we'll check movement, second, centration, third, coverage, fourth, vision, fifth, comfort, and sixth, over refraction. So, these are things we will cover in a post fitting examination. In movement, as you all know, the fitting are three types. One is the flat fit, second stiff fit, and third is optimum fit. So, we required always the optimum fit. This is the ideal fit. So, in examination of post fitting movement, if you get movement of 0.5 to 1 mm, 0.5 to 1 mm, so that is get the optimum fit. If you get very less movement or less than 0.5 movement, that's indication your fitting of the contact lens is the stiff. That means tight fit. It's very stable. Tight fit means stiff fit. It's very stable and very less movement, either no movement. Flat fit, very high movement and lack of or more of lag. So, if your lag is present and bubbles are present, that means there is a flat fitting. Next, we check the centration. Thus, contact lenses are well centered on the cornea or not. Next, we will cover the coverage. Though either lenses are covered, fully covered overall cornea or not. The lens ideally should cover overall from the round around all the center, all the side of cornea, that is called the well covered lenses. We always require the well covered lenses, and then here well centered. Then is vision. After the using the contact lenses, after stability or after 10 to 20 minutes, we will do the this all the post fitting examination. On that we will do the vision. We have to achieve the maximum vision which are have a patient eye. So, after using the contact lenses, patient getting the proper vision or not. If patient is getting a proper vision, so that means we get successfully using the contact lenses. Next, comfort. Comfort is very useful, and each and every time we should achieve this comfort level, because contact lenses are going to use for a all day, full day. So, you required patient should be comfort with the contact lenses, and then we do the over refraction. Over refraction is for either whatever we prescribe in contact lenses, that is power is correct or not, either is over corrected or under corrected, because when you use the contact lenses, there are tear film in between cornea and lens. So, that play a major role. So, it will make a surface. So, if it will make a surface, so it can play a major role. It can change the power by 0.25 or depend on the thickness of the tear film. That is from the topic. Thank you all.